Hi, everyone, and welcome to another Facebook Live broadcast with MedStar Health. My name is Sarah Ridenour, and today I'm joined by Andrea Keller, who is a long title, but she is the Adult Transplant Hepatology Physician Assistant at MedStar Georgetown Transplant Institute. Did I get that all right?
You did. Very good. Thank you.
So May is Hepatitis Awareness Month. So today we're going to be discussing viral hepatitis, how it's contracted, diagnosis, treatment, and more. So stick around. If you're interested, give us a like to let us know you're watching, and be sure to share this broadcast with your friends. Andrea, before we get into the questions, could you tell the viewers a little bit about yourself and what brought you to MedStar and the work you do here?
So my name is Andrea. Obviously, I'm a PA. I've been a certified PA for the last 11 years, working in hepatology primarily, almost directly right out of graduating from school. Originally worked with a private practice provider here in Northern Virginia, and he retired. And as a result, MedStar having a hepatology program was like the perfect fit for me. So I slipped right in there. I now work primarily in their Northern Virginia offshoot office as an outpatient provider for those working up to transplant, those who've had a transplant, those who don't even need a transplant, just to do general hepatology care.
Great. Well, thank you again for being here today. We really appreciate it. So I'll start off with a pretty broad question, but I think it's a good place to start. What exactly is hepatitis?
So hepatitis is really a big fancy word for inflammation of the liver cells. And the liver cells are actually called hepatocytes. So fancy word in fancy lingo is hepatitis. Most patients will come to you saying, I don't drink, when they hear the word hepatitis, thinking that it's only caused by alcohol. There are millions of reasons why you can have irritation in that organ, most of which we don't have answers for immediately, others of which you can identify almost instantly. But yeah, it's just a big fancy word for inflammation of the liver. It doesn't mean anything terrible. It's just one of those Latin medical terms they give you when you're in school.
And so what does the liver do exactly? Where is it located? Just some basic things about the liver.
So the liver is actually the largest gland in the body, second to the second largest organ in the body, first of which is your skin. It is located in the right upper quadrant, kind of tucked in between your diaphragm, which is just under your ribs and your lungs, over top of your stomach and in front of your pancreas. So when patients have right upper quadrant pain, they often think, oh my gosh, it's my liver. Funny thing is the liver actually doesn't have any pain receptors. So that's kind of interesting. It does a ton of things in the body. It is a giant producer of a lot of the proteins our body makes. It is really responsible and important in our cholesterol production and breakdown with the foods we consume and even the natural cholesterols our bodies produce. It breaks down our bile to help us digest our foods. It is responsible for some diabetic management using insulin, glucagon, and glucose management. It is also responsible for a lot of the hormones that our body produces, whether they're testosterone, estrogen, or just generalized body balancing hormones, our red blood cells, breaking down ammonia, so detoxifying a lot of things, particularly medicines that we consume, alcohol that we consume. And it helps us store a lot of things, good vitamins like vitamin A, D, K, and B12, as well as folic acid to keep us a well-balanced whole human.
Okay, and so, kind of going along with that, what is viral hepatitis?
So viral hepatitis is where a virus creates inflammation in the hepatocytes. So you actually contract it from some other source. Right now, there's at least 6 that we know of viral hepatitises, most of which we don't see here in the United States. A lot of them are overseas and in poorer countries. But I will probably touch a little bit on the top 3 that we do here in the United States, which is hepatitis A, B, and C. And of course, being National Hepatitis Awareness Month, on May 19th of this year, or May 19th every year, we do viral hepatitis screening in abundance. Although with COVID, it's been a little challenging these last couple of years.
Yeah. And now what is the difference between like acute and chronic viral hepatitis?
So because viral hepatitis is a virus, anyone can get it at any time. Depending on the type of virus, you can get it from multiple different sources. So Having anything quickly or something that develops in less than 6 months is what we consider acute. And that goes across all medicine for all conditions. Anything that we find is longer than 6 months, or you've had it for a period of 6 months or more, is usually considered chronic. It's the acute cases that present with a lot of symptoms, a lot of problems. That's when the patients are really sick. The chronic ones, which is where it gets really interesting, are those that don't even know they have it. They have absolutely no symptoms, and they could potentially be spreading it because they don't even know it's there. Those are the ones we want to manage most actively long-term, while the acute ones we want to manage immediately so that we can get them feeling better and obviously recovered.
Right. So, can you talk about some of the symptoms? And then this kind of connects with my next question, is talking about the difference between hepatitis A, B, and C. So can you go over like some of the, I guess, basic symptoms that are maybe, all over the board, and then talk about the differences between those three?
Sure. So I'll break it down into acute hepatitis and then chronic hepatitis, and then go from there, if that's okay.
Okay.
So acute hepatitis in most cases can be a lot like the flu, a stomach bug in particular. A lot of nausea, a lot of vomiting, a lot of abdominal pain. In certain cases, patients are yellow. I mean, you have heard or you've seen when a patient has cirrhosis or a patient has liver disease, they're very yellow. That is true. Some of these patients can actually be mentally incoherent as well, depending on how sick they actually are. Some patients also have a great deal of bleeding issues where they're having nosebleeds, gum bleeding, poor or improper healing abilities when they cut themselves. And in some cases, they are completely incoherent altogether and you have no idea what's going on. The chronic guys usually don't complain of anything but fatigue. Almost always do chronic liver disease patients show up and say they just had this crazy long fatigue that they can't seem to isolate. They can't associate it with anything. It's just always there. Some also do complain of some abdominal discomfort. Can't really explain it. It's kind of vague. It's just there. Some do have joint aches and pains. We have heard a lot of that as well. But most people, they don't really complain of anything. Randomly we'll get, I'm having trouble focusing at my job, or I'm just not sleeping well at night anymore. And that's when we start digging a little bit deeper. Now, you can have all three of these. So let's just focus on hepatitis A, B, and C since they're the most common. Hepatitis A, B, and C can all be very acute, meaning you get everything. The fevers, the nausea, the vomiting, yellow, the sickness. I mean, your dead dog going to the hospital, really ill. Hepatitis A, which is the one you read about most in the news often, is usually contracted through food or improperly washed foods. Unfortunately, this virus is contracted through the fecal oral route. So put it together, it comes from a bad place, it gets into another bad place, and then the patients tend to get very ill. Most of the people that will come in contact with hepatitis A, and that's almost everybody, will kick it like it's nothing. 24 hours later, you're good to go. Some cases where the patient may be immune compromised or are just a prime suspect for potentially getting ill can get very sick. And I've seen a few of those cases. These patients have to go to the hospital. They have to get hydrated through IVs. We got to run the numbers, hopefully get their numbers to come down pretty quickly. And then usually over the course of 6 months to a year can make a full recovery without any issue whatsoever. It is relatively rare that anyone with hepatitis A will have really bad liver disease enough to need a transplant. And these patients never develop chronic disease. Okay. So if you're going to get a viral hepatitis, get hepatitis A.
Yeah.
I don't know, and I think maybe we're going to cover this potentially, but there is a vaccine for hepatitis A, and we do recommend it for everybody. And in fact, almost everybody, particularly babies that are born in these newer ages, are getting them. You should get it either before going to school, if at all, and then of course, if you're going to go to college and you're going to live on campus. So right. Hepatitis A is the easy one. Hepatitis B, it is a viral disease that you can contract through any bodily fluid. So breast milk, semen, saliva, tears, blood, vaginal secretions, it's in there. And unfortunately is relatively quickly spreading if you don't know you have it. Most hepatitis B cases, if they're acute, are found overseas or in our unfortunate drug abuse population through IV needles, or those with sexual promiscuity. Again, these patients are yellow, they get very ill, their liver numbers are very high when you look at the labs, they're extremely sluggish. Most can recover when we find it because there's good treatment. Right. the huge portion of people that I see are chronic hepatitis B patients because I see them as an outpatient. We here in the DC area are very lucky to have a huge following of overseers. So we have a lot of different ethnic backgrounded patients. We have a lot of different sects of religion and certain cultural techniques that, you know, are a little different than us. So we see a lot of them come from their home countries that have hepatitis B. They don't even know they had it, and they've had it since the day they were born. These patients don't have any symptoms most of the time. Usually they're screened by their family practice provider for whatever. Their liver enzymes are slightly elevated and they send them off to us to say, hey, what the heck's going on? Mm-hmm. These patients we treat with oral medications very easily, but with hepatitis B, once you have it forever. There is no cure for hepatitis B right now. There is a vaccine. So again, we recommend those that are brand new to the States and don't have the Hep B, or those that are brand new babies get hepatitis B vaccination in regular series as normal. The series does come in a shot of 3, unfortunately. So you'll get one, a few months later, get the third or the second, and then more months later, get the third. Once you are vaccinated, you are protected forever. So you can't get it again, which is great. But if you have the virus, you have it forever and you need to be treated forever.
Okay.
And then lastly, hepatitis C, which has gotten a lot of PR in the last few years, is also a viral disease that you can contract through blood supply. Again, most commonly found through IV or drug using, whether it be through nasal cocaine and sharing straws, sexual promiscuity, tattoos from obviously an unclean source, and then using needles. Hepatitis C was lastly diagnosed in, I think, 1992 when we first realized actually what it was. And in 2012, the CDC made a huge adjustment to their screening protocols for this disease, particularly in our baby booming population. So between 2012 and now, we've been screening a ton of people for hepatitis C, which is wonderful. Hepatitis C is a chronic disease. I have never seen an acute case of Hep C. I'm sure my colleagues have, absolutely. We do transplant for hepatitis C, and in fact, it used to be the #1 reason for liver transplantation up until 2016. Wow. So it has changed drastically. Most of these patients, again, don't feel a whole lot of anything until it gets to be noticed, or they go to their doctor and have their liver functions tested, or insurance lab screening tells them they have Hep C and then they freaking out. But it's easy to treat these days. We have really good medications. It's 1 pill once a day for a course of anywhere from 8 to 12 weeks. Very little side effects, great efficacy. And in fact, we have or are aiming to, between all of us that work in liver and in research in liver, aiming to get rid of hepatitis C by 2030. So fingers crossed, we only got a few more years. Yeah. But yeah, no, it's really easy to get rid of. Unfortunately, with hepatitis C, you will always look, or should I say test positive for the virus, but you won't always actually have active disease. So it can get a little bit confusing in the follow-up kind of years, but it's really easily treated. Hep B and Hep C, unlike hepatitis A, can be chronic, absolutely. They can both lead to cirrhosis, yes. They can lead to liver cancer as well. So it is our job as liver providers to really keep an eye on how the patient looks going into finding out they have disease. And then, of course, making sure we manage them appropriately going and learning after they've gotten disease and even gotten treatment.
Wow, okay. So yeah, it is good to hear though that, like you were saying, there's been a lot of advancements in the past recent years, you know, for treatment wise. And that's always good to hear with anything medical. And you had mentioned, you know, people overseas tend to be a little more susceptible to it. And you kind of touched on this a little bit, but is there anyone else who, you know, is more at risk, or do you see, you know, a certain age range of people, or is it kind of all over the board with, you know, in terms of age and that sort of thing?
So for hepatitis A, anyone can get it. It doesn't matter who you are. I think the people that are going to have problems with it are those that are a little bit more immune suppressed or immune weak, the young, the old. I'm sure you've heard yourself, Sarah, on the news when they say, oh, there's a hepatitis outbreak at this particular restaurant. Which happens, the grocery stores, I've even been victim of it once. The people that tend to get sick are those that are on the extreme of ages or those that have other health conditions. Okay. For hepatitis B, I will say our Eastern Asian countries are hugely populated with hepatitis B. In fact, when I talk with my patients, to be relatively light about the whole topic, it's like if you don't have hepatitis B, you're the weird one because everybody's got it.
Yeah.
In the States, contracting hepatitis B usually is through those higher risk kind of groupings. In the past, before we started screening our blood supply, you could have gotten it through blood transfusion, yes. So we know patients that were hemophiliacs years and years and years ago before they started screening bloods, they were at risk for getting hepatitis B. Same thing with HIV and hepatitis C. The interesting thing was back then, which was in the 80s, we didn't even know what hepatitis C was. It was just considered non-A, non-B. So you had this random weird virus that nobody knew what to do with, but we didn't really know. You got it from someplace. Maybe it was that quote unquote tainted blood we gave you. So that's when the blood screening stuff all came out, and we've been much better about that, of course. We do find that a lot of our HIV patients are synonymously infected with hepatitis B as well, because it is a body fluid disorder. A lot of those that are high risk, like men who have sex with men, or those that are in the promiscuous business, tend to have higher risks of contracting both of those two diseases. And then hepatitis C, we really have been able to isolate very nicely to the IV drug use group. And then of course, the baby boomers, those that, to be very blunt, sex, drugs, and rock and roll, that's kind of where it comes from.
Yeah.
And then of course, those that were in the military. We found a lot of military patients that were getting those air gun vaccines where they literally lined them all up and then started just shooting them down the line, because they didn't clean the needles after. If one guy had it, everybody else got it. So those are the high risk groups, really. Now we are seeing a small switch in some of that because of this opioid epidemic that we're now going through. A lot of younger people are getting Hep C in particular. So women, childbearing, which is not something we would screen these days because they're not in that, baby booming group, which are those born between 1945 and 1965. And then of course, as a female in a childbearing age, the last thing you're going to think about is this chronic viral disease.
Yeah.
But yeah, with those risky behaviors that unfortunately are becoming rampant these days, we're finding more and more.
Yeah. That's interesting, but also, obviously sad to hear that. But luckily, my next question was, can you cure viral hepatitis? And it sounds like, yes, a lot of the time you can. There's, different, can you talk about the different treatment options that someone would have?
Sure. So hepatitis A, like I said, you get it and you get over it. There's no, other than supportive care or hydration and antiemetics, so you're not having so much vomiting and such, there really is no treatment for Hep A other than just making you feel good. But once you get over it, you're done. Hepatitis B is not curable. You cannot cure it. And I say that with grand confidence because right now we do not have a cure. It is being worked on, absolutely. And the patients with hepatitis B are lucky enough to have really good long-term suppression therapy. So similar to our HIV patients who were taking ART therapy back in the 90s, we have been able to morph a lot of that management into one pill taken every day for the remainder of life or until a cure becomes available, which I hope is on the horizon. Once you once you treat these patients, we can actually see the liver start to reverse and heal on its own. So unlike any other organ in the body, your liver can actually reverse a lot of the damage that was originally done. Hepatitis B, in all honesty, used to be the scariest virus to get because you could potentially get very sick and die from it. It's now not becoming so scary because patients are living with it every day and taking one pill, not even knowing they're doing it. Most people in the world don't even know they have it and they're doing just fine.
Good.
Hepatitis C, as of 2014, I think, was officially cured. It is a curable disease these days. Again, with the oral, what are called direct acting antiviral treatments out there, we're able to treat patients with one pill once a day for a very short period of time. Years ago, we were using all kinds of interferon-based drugs and injectable medications, multiple pills, multiple follow-ups to get maybe 45% cure rates. Now we're getting up to 98% cure rates. Patients are in love with these therapies. I've treated hundreds and hundreds of patients. My success rate is nearly 100%. I mean, it's amazing to be part of such an evolution of a drug and of a treatment and of a course. It's outstanding. But yes, hepatitis C is curable, hepatitis A resolvable, hepatitis B livable.
Yeah. Well, that's great to hear. That they're all pretty treatable, and in some cases, yeah, they're curable. So I'm just going to take a second to pause real quick,
Sure.
and say if you're just joining us now, thank you for tuning in. We're joined today by Andrea Keller, who is the adult transplant hepatology physician assistant at MedStar Georgetown Transplant Institute. We're discussing viral hepatitis in honor of this month being Hepatitis Awareness Month, and we have a lot more to talk about. So stick around, share this video with your friends, and give it a like to let us know you're watching. And of course, if you have any questions for Andrea, you can ask them in the comments below. And we actually we have one question from a viewer that I'm just going to go ahead and ask you now.
Sure.
Robert, thank you for your question. He asks, what are some signs of your liver failing from Hep C, especially if you haven't taken any medication for it to get rid of it or keep it under control?
Sure. So usually liver failure is kind of a weird thing. It doesn't just happen all of a sudden one day. It probably has been building over time and the patient just didn't know it yet. A lot of the first symptoms a patient will mention is, I'm noticing a lot more fluid retention in my ankles. Usually it's bilateral, so it means it's on both sides equally, and it starts in the feet and ankles, and then it starts to move its way up the legs. In addition, some of those patients will also notice that their pants or their belt line is getting a little tight because their abdomen is becoming distended. That is a sign that the liver is not able to balance the proteins that it's responsible for, as discussed previously. And by default, you're gaining excess water weight. In addition, some of these patients may notice a little bit more nose bleeding episodes, gum bleeding episodes, potentially really simple bumps of the skin creating great, bright red bruising. If you cut yourself shaving, it takes forever for it to heal. As the disease progresses or as the liver continues to fail, of course, there is some muscle loss and weakness. So we notice the patients tend to get very thin in and around the cheeks and the temple area, through the neck and up here in the chest. Their arms get very thin, but yet their bellies get very wide and big. They also become a little bit more sluggish, mentally harder to focus, harder to concentrate, and have memory challenges. Of course, they can turn yellow, as mentioned previously, and that's usually when we start to get pretty advanced. In the absolute worst cases of liver failure, these patients can have some GI bleeding, which can be devastating in some cases. They can also, again, run into those comatose type episodes where they just show up in the ER completely obtunded, and we're having to figure out exactly what's happening. Most of the time, if the patient knows they have Hep C and just hasn't treated, or even if they don't know they have Hep C and they follow regularly with somebody, the blood work's going to show it first. And the labs will reflect abnormalities in liver function, in their clotting time, which is called an INR, and in their platelet counts. So we look at those very closely in patients. And then when we meet them for the first time, we go back into their history and we say, okay, when was this first noted? And how long has it been going on? And then we take the steps. Once we know, you can reverse a lot of this sometimes. If the fluid is there, we give you water pills, or sometimes we have to drain it out actively. If we can remove those elements of fluid overload, sometimes it never comes back, sometimes it does. We also have appliances that we can actually insert into the body to help shunt the fluid in other places so that we can get it to resolve and give patients better quality of life. If they're yellow, we obviously have to address why they're yellow, and that can come from a myriad of places. So we can reduce that over time, yes. We can get their mental focus back for a lot of these patients as well. In an absolute worst case scenario, if it's failed enough that we can't help them, we have to talk about really drastic measures, of which the number one is going to be liver transplant. And then depending on where the patient falls in that whole category, we'll treat their Hep C if necessary. Sometimes we wait until after they've been transplanted to treat them thereafter. But it really does depend on a very individualized patient-based case. Every time we meet someone, it's a different story.
Right. Well, thank you for answering that. And thank you, Robert, for your question. And that actually kind of answered, the next three of my questions that I have for you.
I knew that was going to happen.
But I'll kind of from them again. Yeah, that's okay. That's okay. So my next two were, how do you know if you have viral hepatitis, and can you screen for viral hepatitis? And you've talked about both of those. The symptoms obviously is a way of knowing, and then you do get screenings. So can you just talk a little bit more about that, and maybe talk about a little bit more about what the screenings actually are, how they work?
Sure. So most screening is done through blood work. going to the lab and just literally having them draw a viral hepatitis panel, a regular liver function panel test, CBC, which includes your red cells, your white cells, and your platelet count. And in most cases here in our practice, we draw the INR, which is the clotting time. Depending on how they look, would tell us exactly what to do and where to go. Hepatitis A, B, and C will be positive or negative. It's a yes or no answer. It's after we know that information that we have to dig a little deeper. And then we have to figure out if it's positive, what kind of hepatitis. So, hepatitis C comes in 6 different types as well. So then we break it down to what is called a genotype to find the genotype. And then we get a viral load to actually get how much virus is in the system actively. And depending on where those numbers sit and depending on the health of the organ, we then pursue treatment or transplant or more testing or whatever. The other great way to screen for any kind of liver disease in general is to do an abdominal ultrasound, which is the most simple test, similar to what a pregnant lady goes through when she has the baby evaluated. They rub some jelly on your belly with a wand. They look at the liver in terms of size and shape. They look for masses that are abnormal. They even look at the gallbladder, the pancreas, and all the organs right around the liver to make sure that all the filtration systems and the ducts that connect them together are nice and open. And then if that looks funny, we do MRIs, we can do CT scans, we do upper endoscopies and all kinds of weird things just to make sure that the whole system is healthy. And then we really come up with a nice plan, because depending on where the person is, pre-treatment or pre-diagnosis helps us decide how we're going to do with it post-diagnosis in terms of long-term management.
Right. And, that's the best. You're going to get the best care when it's personalized towards you and you go through all these different tests. Yeah,
it's usually a lot in the beginning, but then once we figure it out, it gets really streamlined. And I think, a lot of patients with all these questions, they walk in and they're like, I don't drink. I did when I was in college, but I haven't in years, and all these things. And they jump to the worst case scenarios until we can actually break it down. And then once you know what you're working with, it gets a whole lot easier.
Exactly. Yeah. And so then my next question, you touched on when answering Robert's question, was, will I need a liver transplant if I have viral hepatitis? And it sounds like that's, a possibility, but not always the case. It's more in extreme cases.
It's true. So, again, like I said before, hepatitis C used to be the #1 reason for liver transplantation up until just a few years ago. We are now actually transplanting more people these days for fatty liver disease, or what is called non-alcoholic steatohepatitis. That's scarier to me than viral hepatitis, purely because so many of us here that live in the States don't really take care of our diet and exercise programs as much as we should, and by default could fall into this category. But not everybody who has viral hepatitis will need a transplant. Not everyone who's been transplanted had viral hepatitis. It really does depend on how you as a person are healthy in general, what kind of disease you have, how bad that disease is, and then how effective we can manage it using all modalities except surgery. And sometimes we're really good at it. Sometimes we're not. Sometimes the patient is really good at responding and sometimes they're not. Mm-hmm. So, it's in very unique cases that the patient will walk in the door and we look right at them and say, wow, you're going to need a transplant. It's just inevitable. And in those cases, the patient's usually very sick and it's completely obvious.
Right. So we actually just got another question from one of our viewers, from Judith. Thank you, Judith, for your question. And I think this is interesting. She asked, once treated and in remission, can Hep C reappear?
That's a good question. So hepatitis C, once you have been cured of it, cannot return, no. However, you can get it again. So example, patient comes into the office, had hepatitis C 30 years, got it when they were, during childbirth, needed a transfusion, got Hep C. Treat them, no problems. As long as they do not interact with anyone else that has Hep C positive blood and their bloods don't mix, that person is good to go permanently. Let's talk about the new guys, those ones that are current IV drug users, because we are treating current IV drug users with Hep C. I think it's the best population to treat so that we're not continuing to spread this, but it is an active and hot topic because it's a really controversial thing. But if you're an active IV drug user and you come to the office and you say, I want to treat my hepatitis C, we'll do it. The best advice and education that we can provide to the patient is not do you have to stop using drugs, because that's important. Absolutely, you should stop using drugs. But for hepatitis C, don't share the needles. Don't share
Right.
the needles. Go to the needle exchange program, get your own set, clean them out if that's what you want to do. And if you need to keep using medicines for whatever, do it. But sharing of the needles is where the problem is. So if this person came to my office, had Hep C, I treated her, she's good to go, and then goes back out in the community and shares needles with her boyfriend, who shares with his girlfriend and boyfriend and girlfriend and boyfriend, it's very possible that this young lady is going to get Hep C again. So unlike hepatitis B and A, when you're vaccinated, you're protected. With Hep C, if you have it, you get rid of it, but you can get it again. No one can reinfect themselves, which is really nice.
Yeah, that is nice. But yeah, well, thank you for explaining that. And thank you again, Judith, for your question. We also have another one from Maurice, and they ask, is there a period of time to catch the virus from saliva or any time?
So it's gonna, again, you have to mix a great deal of body fluid for this to work, I guess. One of the best interactions we can describe, if a parent has hepatitis B, because B is the one that is transmitted through body fluids, particularly saliva and stuff. If you have hepatitis B and you are drinking out of the same cup and your daughter drinks out of the same cup and doesn't have hepatitis B, there's a really low risk of contracting it.
Okay.
If you yourself have hepatitis B and you are married and you and your spouse are kissing and hugging and loving, the chance of getting Hep B is much higher. Right. To catch it is tough because sometimes these viruses don't actually show up in the blood work for weeks to months, anywhere from 3 weeks to 6 months for us to actually see antibody test markers in the blood work.
Oh, yeah.
Yeah, so it's hard. It's hard. That's a tough question, and I don't think anyone really knows the answer to that. I do know that we have quote unquote prophylactic ideas on how to help patients get through these kind of scenarios. So, obviously we're recommending all family members that live in a house who has a hepatitis B positive patient that they get vaccinated against it. So don't have to worry about it. Once you're vaccinated, you're good to go.
Yeah.
The other thing is treating the person that has the virus. If the person has the virus, treat them, then they can't spread it anymore.
Yeah.
And the similar idea goes for the HIV population. It's just, we can't, if the person doesn't know they have Hep B and they're sharing their saliva with other people, how do we know when anybody gets it?
Yeah, exactly. And so once again, thank you for that question, Maurice. And once again, that kind of covered in my next question. Was no. Once again, that's fine. That's fine. Is if you can spread it to family and friends.
Yep.
So I'll move on to my next question, which was, can I donate blood or organs if I have viral hepatitis?
With viral hepatitis, you cannot donate blood, period. Okay. The CDC, FDA will not allow anyone who has active viral hepatitis to, or even antibodies for active viral hepatitis, to donate blood. And that is through a screening thing. So what happens, if you go to donate blood and you don't know you have hepatitis, they screen it for all the viral diseases, including HIV. And then they send you an anonymous letter from the health department that says you tested positive for hepatitis A, B, C, whatever, on your recent blood donation. Please contact your local provider to discuss what needs to happen next. Oh. And then you go to your doctor with this letter and you explain whatever, and you're panicking, and the doctor rules it and figures it out, and there you go. Yeah. If you have active hepatitis, you can donate organs though. And that's a really cool thing. This all really just started to change too. Wow. Again, yeah, no, I know, right? So before we used to hold out for like the perfect organ. These are still perfect organs. They're just organs that we used to throw away, which is such a waste. So many people need organs, and there's not a lot of donation really, because we rule all these weird things out. Right. Even really recently, as in, I don't know, 2-3 years ago, we started accepting hepatitis C positive organs, which is something we used to never do. Okay. The reason now is because the treatment post-transplant is so easy and so tolerable that the patient who is desperate to get an organ to fix whatever is going on, whether it's a kidney, tissue, liver, eyes, heart, it's so much easier to manage the viral possible disease thereafter than say, no, we can't accept that organ. You're going to have to wait another 7 or 8 months. Right. So yeah, then might be late. Yeah, exactly. And we still do look for quote unquote perfect organs. I mean, we want pristine organs. We don't give patients bad organs. That's absolutely not what happens. Yeah. But just because it has a virus that is totally controlled and or treated when it's in your body for the first time. Why can't we do it if it's in somebody else's body? So we do, and it works. And we've had so many good successes. And in fact, I digress, I'm sorry, but the period right after transplant is so overwhelming for patients in general, just because they're on so many medications and they're seeing so many doctors and they're in and out. You're technically taking medication you don't even know you're on, because it's so much all at one time. And then by the time you get 6 months out of transplant, you don't even know you're on it anymore, or you're not even on it anymore. So, as part of what I do here, when I talk with a patient about the idea of needing a transplant, one of the first couple topics we hit is, do you want to, and would you be comfortable accepting a Hep C positive organ? And we have a consent, and we go through the whole thing, and we ask them their thoughts, and we talk about it a lot, just to get them comfortable with the idea. And then again, in a lot of cases, these patients get these beautiful, perfect, potentially Hep C positive organs, and within the first 3 months post-transplant, the Hep C is already gone.
Yeah, that's good that you like you said, really sit down and explain with them that, like you said, this isn't a bad organ, because I think a lot of times people would hear that it has this virus, and they would automatically be like, no, I don't want that. But
it's the connotation, unfortunately, the connotation of having liver disease is not one that everybody likes. I've been doing this. I work with these patients. We talk about real life issues. Addiction is a real thing. We have these conversations every day. This is something that I think people need to become more comfortable with. And when they do, if they do, this is going to be like the easiest thing for people to discuss going forward. It's just we're not there yet. We're not ready. So some people can and other people can't, but we here are very fluid with these conversations because this is what we do.
Yeah, that's good. And it's also sad to hear or think about all of those organs that, like you said, in the past had been thrown away that could have helped save someone's life.
Yeah, it is very sad.
The case now, and seems to be changing and progressing with time.
We're getting there.
Yeah, we'll get there eventually.
we're on everything's a work in progress. It's called the practice of medicine for a reason, right?
Exactly. And so my next question is, can viral hepatitis affect any of my other organs other than the liver?
Yes, it can actually. So when you have hepatitis, you primarily have a liver disease, absolutely. But because your liver pumps the blood in and out of the system and filtrates everything that you eat, do, and whatever, it can affect a lot of the other parts of the body, absolutely. So we do see a lot of liver patients that have concomitant liver and kidney disease because the two share a blood supply. We also have a lot of patients who have hematologic disorders like anemia and white blood cell decline, platelet decline. We also have a lot of patients that can actually have skin disorders as a result of having hepatitis. They're relatively rare. Those are patients that have much more advancing type liver diseases, but yeah, you can get liver disease and skin disease and bone disease and mental disease. We have a lot of mental health issues with liver disease. And again, there's a correlation, whether we can actually tell you exactly how and why that happens, but we do see a lot of combinations there. Long pulmonary disease, we do see a lot of pressure on the pulmonary system, on the cardiac system as a result of liver disease. I mean, this is a big organ. We're talking a big organ in the center of your body that does shunt blood up and down in all fashions. It can affect almost anything, to be honest with you. But most of the time it's rare, and it's usually when the patient has quite advanced liver disease. Okay.
You mentioned having it affecting your mental health. I'm curious if your program has recommendations that you give to your patients, or how you kind of help them with that aspect of it.
So we do and we don't, I should say. Everyone who is in the process of being evaluated for a transplant here does meet with our social team and does meet with our mental health support team, absolutely. And sometimes we establish care with local psychiatrists and psychologists to help them either deal with the idea of just having a transplant or deal with the idea of what's going on in their liver for why they're having the transplant. Sometimes we don't. I mean, there's a lot of patients that I've met over the years, where I start talking with them, you create this relationship, and then you start to realize, have you always been this anxious? You've always been this anxious, haven't you? And then we find out that a lot of the root for sometimes even why they have liver disease is because they were trying to treat themselves with alcohol or substance others and whatnot. So we do see a lot of anxiety and depressive type issues around here. I myself am not afraid to write for some of these medications to help patients find a little bit of a bridge to get the real care that they need. But I do make a lot of referrals to local providers for mental health support, absolutely. And our social work team has been really good. I know there's only a few of them and they do see a lot of our patients, but they do a really good job of giving resources to people, helping with some family support, because it's not just a patient disease, it's a family disease, particularly if they're going to head off to transplant, because then they need caregivers and their whole life changes. I mean, everything about them is different, not just the scar on their belly. So it is something that I am a huge advocate for here, purely because I think, you can't expect someone who has a chronic disease to just accept it immediately and then say it's okay and move on. So, we do, but we don't. I mean, nothing is set in stone around here, but we do have great resources for a lot of our patients.
Yeah, that's awesome to hear. I feel like that's a aspect of a lot of different, like you said, illnesses that isn't always thought about right away, but is definitely has a big impact on the treatment and recovery process and everything.
Absolutely. And for a lot of these patients, if they don't need transplant, they have a chronic disease, which means they have it forever. So this is not something you treat one and done, go home, you're done, you don't ever have to come back. I mean, these people come and see us every 6 months, sometimes more frequently. And they're seeing us for years, decades, just to, keep, hey, everything's still looking good. Hey, you're still functioning normally. Hey, you don't have cancer. Now let's move on for the next 6 months. And again, I think from a preventative perspective, screening the patients for these type of major problems that can develop even after treatment and cure is just as important as treatment and cure.
Right. Yeah, exactly. So my last question for you is, are there any resources for people to learn more about viral hepatitis?
Yeah, so you can Google anything these days, although I recommend that you don't. But of course, there are lots of websites that are really helpful. So the CDC, Center for Disease Control, has a really good website. It's www.cdc.org. They have everything on there, and I'm sure everybody's so overwhelmed by looking at it in regards to COVID. But there are other diseases out there that are still being talked about, and the CDC will discover. There's a Hepatitis B Foundation specifically designed for Hepatitis B management and information. There is the liverfoundation.org website, which is designed for research, developing new protocols, new patient information to share for how you diagnose, how you find it, how you treat it, how you live with it. The Department of Health and Human Services. Obviously, MedStar Georgetown Transplant Institute has a great website. I highly recommend that one. And then the National Institutes of Diabetes, Digestive, and Kidney Diseases, which is unique because it does involve some of the kidneys there as well. But you can go to any really well-trusted website, to any giant institute who does liver management, and you'll get some great information.
Great. That's awesome. And, I lied. That's not my last question.
Oh.
My last question for you is that what's the, message you want people to take away after watching this broadcast?
That's probably the hardest question. I don't know that I need anyone to take anything away. I think what I would hope people would take from it is that screening is important. Right. It doesn't have to be just for hepatitis. Mm-hmm. I think in order to stay healthy and well forever and for long, you've got to be on top of your health. I think the last 2-ish years now have been really challenging for a lot of people in general, just because of the COVID thing and the seclusion and all of the we don't know and all this stuff. That has been very overwhelming, and we've put a lot of our health off. That's not okay. You can't do that, because you should catch it before it becomes a problem so you can treat it effectively. Because when it's a problem, what do? You panic. And then panicking does nothing for anybody. So, in regards to hepatitis, it is manageable. People walk around with it all day long and don't even know they have it. We can find it, we can treat it, we can manage it, no problems. But when it comes to taking care of your health long-term overall, screenings is the first place to start. Second place is finding someone you trust to help you get through it, to treat you, to give you the confidence you need in the choices that you're making for the decisions of your own healthcare. And then always sticking to that thereafter, because it doesn't just end with, you're cured, it's good, yay. I mean, ask a cancer patient. A cancer survivor does not leave their oncologist, right?
Yeah.
Same thing for liver disease. You shouldn't leave your hepatologist because this is what we do for you, and there is more to come thereafter.
Yeah.
So that's probably it. Don't be scared of it. It's okay. We'll make it work, but it can be really scary.
Yeah. Well, I think, that was the hardest question. You handled it perfectly.
Well,
that was great.
I was not ready for that one. That's why.
I threw that out at you.
That's okay.
But yeah, like I said, I think that was the perfect way to wrap this broadcast up. So thank you again for joining us. We really appreciate you taking time out of your day to be here and answer our questions. And thank you to all our viewers for watching and sharing your questions as well. For more information or to schedule an appointment, please call 202-444-3700. You can also visit the link in our description for more information as well. And thank you again, everyone, for joining us. And we will see you next time.
Thanks, Sarah.
Bye.